Welcome to the Demystified podcast. In this episode, we're going to be talking all about Pitocin. What is it? Why may you need it? And then also what to do if you're feeling really anxious about Pitocin, because it is something that a lot of us have some anxiety about, because normally we hear Pitocin is this really horrible, painful way to go into labor, but it doesn't have to be this way. So we're going to discuss in this episode everything that you need to know about Pitocin. Welcome to the Demystified podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the Demystified podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you. If you've been wondering about Pitocin or feeling some anxiety about it, this is the episode that you want to listen to. So first, we're going to start with explaining what is Pitocin, and then we're going to go over some things that you may not have known were options when it came to Pitocin. So Roxanne, what is Pitocin?
What is Pitocin? It's a great question that not many people will even ask.
So Pitocin is synthetic oxytocin. So oxytocin is our love hormone. This is what we release naturally in our bodies when we feel safe, supported, loved, when we orgasm, when we hug someone we love, when we kiss someone we love. When you're breastfeeding, that milk letdown reflex comes from oxytocin, but it also causes uterine contractions. So it's a very helpful hormone within our bodies for starting and sustaining labor. And synthetic oxytocin is Pitocin. In some other countries, it is called like syntocin, but whatever synthetic oxytocin is in your country, that is what Pitocin is. It is made in a lab and it's administered through an IV or sometimes given as a shot. The goal of Pitocin is to cause uterine contractions. That is the only similarity that it really has with oxytocin, is that the goal that we want when we're giving it is to cause your uterus to contract. So oxytocin has other roles within our body of providing the release for when we hug someone, when we love someone, feeling safe, supported, as well as helping the milk letdown reflex. It has other roles aside from just causing uterine contraction, and it works differently in our body because of all of those roles, whereas Pitocin, the only goal is to cause those uterine contractions. But our body can sometimes, with Pitocin, start to stimulate the release of oxytocin as well. And then when both of them are releasing, this is when sometimes there could be issues. Because with Pitocin, with every drug that we take in life, there are risks and benefits with them. With Pitocin, there is the risk that your contractions can become too strong and too close together. And this becomes an issue because babies during contraction have no blood supply to them. This is when they're like cut off from the blood supply. They have a 10-minute reserve, which is like their oxygen tank for labor. And this is to help withstand the stress of labor naturally. But during contractions, they can't refill their gas tank because they're cut off on the blood supply. In between the contraction is when they fill that gas tank. If they're not having the breaks in between contractions, they're not refilling their gas tank, and eventually this can cause babies to not be able to withstand the stress of labor. And then this is what causes babies to go into distress, where their heart rate is going down and could potentially start the cascade of interventions, as well as potentially leading to a C-section. So with Pitocin, it is a high-risk medication. For all nurses, all medical providers, it has a big label on it because of the risks that it can have for baby and the person receiving the oxytocin. Like the Pitocin can have risks, and it's a high-risk medication because of the effects that it could have on somebody's labor. Not just baby, but it can also increase someone's risk of having postpartum hemorrhage after the fact. And this is because we only have so many receptors on our uterus for the Pitocin or oxytocin to attach to. And if the body is flooded with all of these Pitocin just waiting to attach to these receptors on the uterus, once that baby comes out and our body starts producing oxytocin to cause that uterus to contract down, all of those receptors are flooded with that Pitocin, and it's not going to be able to get that uterus to contract down after baby. And this is not ideal. Obviously, we need the uterus to contract down so that they're not bleeding. There are other medications that we can give, but Oxytocin and Pitocin are like the best ones to give immediately. So there are risks associated with it. Commonly, though, you'll have people say, I don't want to get Pitocin because the contractions are worse and they're too strong and they're a lot more painful than spontaneous labor contractions. That is a very common fear that we hear with Pitocin, is that they're very painful contractions. They don't feel the same. They're more painful and they're stronger. And this is true and potentially could be stronger because your body is producing that oxytocin at the same time and causing those contractions to actually get stronger than you need and potentially cause stress for those babies. But with oxytocin, we release these natural endorphins, these natural painkillers within our body when we're releasing oxytocin to like take the edge off of the contraction. Labor is not pain-free if you go into spontaneous labor. This is like important to note. Like you still have discomfort or pain, however you want to describe contractions. You still have it if you go into spontaneous labor. But your body is releasing these natural endorphins because oxytocin is our love hormone. It's our feel-good hormone. It makes us feel happy, whereas Pitocin does not give us those benefits. It is just uterine contractions. So you may have the same strength contractions, but you don't have like the relief, the happiness relief that oxytocin gives you. So your perception of them is different.
Something else that I might contribute towards this change in perception is when I reflect on my own experience having Pitocin, I was very anxious and stressed out in that moment as well when I received it. So I was not in a good mental space to allow my own natural oxytocin release as well. And so like when I compare my first birth where I had Pitocin to my most recent 2 births where I just had my normal oxytocin, I can't tell you if those contractions were more painful because of the Pitocin or because I was spiraling mentally. And so I think that's something else to consider when it comes to receiving Pitocin. Sometimes it's an unexpected intervention. You may be unexpectedly induced or maybe not wanting to be induced. Maybe you had this vision or this plan. You may feel like you're being coerced into it, which is going to bring you into a different mindset. And so not being in a quote unquote great mental space when it comes to addressing labor or feeling very anxious and not feeling like you're not in a safe place is also going to impact how you feel about your contractions too.
100%.
And so Pitocin doesn't cross that blood-brain barrier to help with the endorphin release when it comes to our oxytocin and with our labor contractions. But we also have to consider how someone is probably feeling if they're receiving Pitocin and how anxious they may or may not be feeling, because that is also going to impact how their contractions feel too. And so if for whatever reason, like our listener, if you have to receive Pitocin or like you're supporting somebody that has to receive Pitocin, understanding like this is a valid fear that folks have, that the contractions are going to be so painful, I'm not going to be able to tolerate it, especially if they had a birth vision for themselves where they wanted to have this low intervention unmedicated birth, which is totally valid to want. It's a little bit harder to have a low intervention birth when you need a labor induction. And so, one, they may be battling with a change in a birth plan that they may or may not have been expecting and or wanting, even if it is medically necessary. But letting them know that they're still safe, like you're still there to support them. Like for you, the person that is laboring, like you can still like be in control of the situation and navigate it. And so we're going to talk about what options that you have with Pitocin, because sometimes if you have to be induced, you don't always know what options that you even have. So we talked a lot about like what Pitocin does and what are the potential side effects and why some folks are like really anxious about Pitocin. But why should someone get it at all? Like, shouldn't everyone just go into spontaneous labor and like have a no intervention birth? Wouldn't that be the best, quote unquote, option? Like, why would somebody consider getting Pitocin? Like, what are the benefits of receiving it?
Yeah, I mean, obviously, ideally, we want everyone to just go into spontaneous labor. It's a lot less work for me personally, the nurse, and it's also a lot. Usually, a lot more people are more satisfied with a spontaneous labor experience than an induction because it's not as long. Inductions can take a really long time. A long time. I mean, labor can also take a really long time. 2 days, 2 to 3 days. But inductions can take like 4 or 5 days for some people. But there are reasons to still use Pitocin and be induced, such as medical reasons. So if you have some sort of either pre-existing, so this is a medical condition that you had prior to getting pregnant. So if you have type 1 diabetes or like a heart condition, or if you have like a blood clotting disorder, those are considered high risk conditions that usually are recommended to have inductions at certain intervals. Every condition has a different recommendation. And if you do not go into labor before that recommendation, so with like gestational diabetes, this is a condition that develops during pregnancy that also has a recommendation for induction, again, by a time frame. For gestational diabetes, like the time frame is 39 weeks for most people, unless you're like pretty well controlled, diet controlled, then you can go to 40, 41, depending on your provider. But if you don't go into labor before that 39 weeks, if you don't go into spontaneous labor, then the induction happens. But people can go into labor before. We know many people that had their babies before their induction date. The other recommendation is for not surpassing that 42 weeks. So the medical induction of post-term, which is after 41 weeks, or post-dates, it's also called. This is another reason that they would recommend inductions because they don't want pregnancies to pass 42 weeks.
So I think it's also important to note that even though there are these general guidelines for each medical condition that you may or may not develop during your pregnancy, you are still an individual, and your individual medical situation should be taken into account when it comes to whether or not you should be induced. And so there are general recommendations, but you're still individual. So just because you have X, Y, or Z does not mean at 39 weeks you have to have an induction. Like, it is based on like what is going on with you at that time as well.
Just like with like the 42 weeks, the risk of going past 42 weeks is that there's an increased risk of stillbirth. But some people naturally carry their babies longer than 42 weeks and are fine. Like, people still have babies at 43 weeks or 44 weeks. We're all individual people, and there are things that they can monitor for to kind of help rule out all of the increased risks as you progress through your pregnancy. So there's options available. Like, if someone schedules an induction for you and has zero conversation, that's a pretty big red flag. Having a conversation with your provider of like, what are the risks and benefits of being induced versus what are the risks and benefits of me waiting? Like, which one is worth it to me personally? Because my choice for something regarding pregnancy and birth would probably be different than Gina's choice for pregnancy and birth because we are two different people. They might be the same, but they might also be different. But the reason that we would give Pitocin is during that induction process, if you were already, 3-4 centimeters, that kind of rules out a lot of our options with inductions. And the other option is like breaking your bag of water, which some people would not like to do first. So Pitocin is that great option that's available. With Pitocin, it is IV. And it's out of your system within like 5 to 15 minutes, depending on like the dosage. And that's pretty quick to like leave your system if needed. But aside from just induction, so like you have a medical reason or you're just choosing to have an elective induction, which is a totally valid choice for you. If you come in labor and some labor stall occurs where your labor slows down, it doesn't pick back up for the usual reasons of like we've corrected baby's position, nothing's going on with that. You're not having any like pelvic floor tension or like tension within the path that baby is going through. And potentially the reason that the labor is stalling could be maybe you're getting an infection. Maybe you haven't slept in 4 days and you really need some sleep. Maybe you need to eat, or maybe you're dehydrated. So something's going on with you that maybe Pitocin could be a beneficial tool at that point. And that's the other thing, like with Pitocin, it is very like feared. People are afraid of it, but not everyone needs it. One. Like, not everyone is going to arrive on labor and delivery and be like, hey, I know you're in labor, but let's give you Pitocin to help speed this stuff along. I'm not saying doctors don't do that. There are definitely people that probably you get to a hospital and they're like, okay, like, you've been here for 30 minutes and you have not had a baby, even though you arrived at 4 centimeters. Let's give you Pitocin to help like speed this up.
Just get you over this hump.
Let's get you over this hump. Have this baby.
What hump? What hump are we trying to get over?
It's just the labor hump. But in those cases, yes, Pitocin is probably not advised and potentially could be harmful because you're getting too much in those contractions. At that point, with oxytocin and Pitocin could be too strong and too close together where baby's not resting. But it's a tool that's available to the people who actually could benefit it from either being induced, like if like nipple stimulation or other options aren't helping to induce that labor and progress it, and they need to have their baby for some sort of medical reason, Pitocin is a tool that is available to be able to make that happen. Or let's say like maybe you starting to develop that fever. Again, Pitocin is a tool to be able to kind of help progress your labor so it doesn't have to lead to a C-section because you've developed some infection during your labor.
Sometimes I do find if someone gets an epidural, sometimes their contractions will space out a little bit, and then usually when they get an epidural, they're probably going to receive some Pitocin later on just because their contractions space out too much. Not every time. Usually I find if someone goes in with and gets an epidural with a really strong labor pattern and their body is progressing pretty quickly, like they're not going to need it. But I would say about half the time, like my doula clients will probably get Pitocin if they get an epidural, just because like the body relaxes and
there's like different reasons. Again, I don't have the research to support this like off the like right now, but there are different reasons that by getting an epidural, this could slow down labor. Number one, as we probably know, the increased in pressure from gravity assisting baby, putting more pressure on the cervix is decreased because you're laying flat now on a bed. Like your baby's not putting as much pressure on your cervix because you're no longer in an upright position once you get that epidural. Number two, if you are dehydrated, when you come in, you are probably going to be contracting more and they're more painful when you're dehydrated, but they're not doing as much to your cervix. They're just kind of, it's irritability. Your uterus is like, please, I'm so hungry for water. I'm so dehydrated and it is a desert in here. Please give me fluids. So what do you get before you get an epidural? A ton of IV fluids. And then your body's like, oh, thank you. And your uterus is like, oh, finally, I can relax. And then you're like, well, your contractions are now 7 minutes apart because you probably were contracting because you were super dehydrated. Because we put the Foleys in usually within an hour after the epidural. And I can tell when you were dehydrated because your pee is like brown. Not really brown, but it's like pretty dark yellow. And I'm like, well, that was why you were in labor, because you probably drank 1 sip of water today. And so that fluid helps to hydrate them, but then that leads to their body. They weren't in true active labor at that point. And now we gave them this epidural. So we can't like take it out and send you home at that point. You're pretty committed to having a baby today. So then that Pitocin is needed for that case because they need it and they're not in an upright position to kind of help stimulate the natural labor feedback loop.
So let's take a break from our episode to talk about our podcast sponsor, Needed, because Needed has this amazing drink called Hydration Support that can help you hydrate during your pregnancy, during your labor, postpartum. Roxanne personally really likes the grapefruit flavor.
Grapefruit is the only flavor you should try.
And it has a really subtle taste. So I almost compare it to like a seltzer water that has like a bit of fruit flavoring to it. So it's very subtle. It's not like super overpowering, which can also be really nice during labor when like strong taste can be just too much.
Yeah.
So if you want to check out Needed, you can check them out at thisisneeded.com and use code MAMASTAYPOD to get 20% off your first order. We really like the hydration support. You can use it during your pregnancy to help with hydration, which can also decrease like Braxton Hicks and like cramping and just discomfort. Also, hydration probably fixes a lot of issues that you may be having.
Hydration is the solution for a lot of things.
Not everything, but a lot of
refreshing.
Things.
I think the Needed hydration support is very refreshing. It's nice, subtle flavor. It's pink when you put it in a cup, so it looks pretty as well.
Because aesthetics are really important.
It is very important.
So if you want to grab some Needed to support your pregnancy, during your birth, or even the postpartum, because it can also help with breastfeeding,
yes,
head to their website and use code MAMASTAYPOD to get 20% off.
If the reason that you got an epidural is because maybe you were planning to go unmedicated, but you've been in labor for like 2 days, this could be a reason that your contractions are going to slow down because your body is like, finally, we can sleep. We need to rest. So I find that it's like after an epidural, I usually will try to give them a break where I don't bother them so that they can actually have some uninterrupted sleep to kind of help refill that little sleep tank. If that's not a real thing, but in my mind it is for labor. Refill their sleep tank, because usually after they sleep for like 1 to 2 hours, I might go in there and just like shift them a bit. But once they sleep for 1 to 2 hours, their contractions a lot of the time have picked up on their own. But if after 1 hour, your provider's like, her contractions are 15 minutes apart after she got her epidural, we need to give her Pitocin to help put those together, that's when it's very commonly introduced. For those are like the most common reasons that I've personally seen, is because they're laying flat, they're not putting pressure on the cervix, they're dehydrated, so we gave them a ton of fluids, and then their body's like, oh, hydration is nice. Labor I was not in. So now my contractions are gone. And number 3 is their body was just so freaking tired. It's smart. It's not going to continue to have contractions when you need to sleep. And so your labor spreads out because your body's like, finally, let's just take a break for a second and recover from those 3 days of labor, and then we'll continue. But you can't just sit there for 3-4 hours doing nothing.
I think that's another big difference between Pitocin and Oxytocin as well. So our normal occurring oxytocins, that it ebbs and flows based on our needs during labor. And so it can be pretty normal if you are in spontaneous labor for contractions to just space out when you're feeling more tired, when you're feeling hungry, and your body's like, okay, hey, we should pause a little so that we can eat and sleep.
As you transition through the phases, between phases, you'll have like a little rest and digest phase.
Yeah. And so it's normal for our contractions straight to kind of ebb and flow based on our needs. But that does not happen with Pitocin, because it's just like, you need some more. You need some more.
Just continue coming.
So let's talk about what options does somebody have with Pitocin that they may or may not realize that they do. And I will say not every birth location will be supportive of offering these options as well. So it
might be harder to get them.
It is important to have a conversation with your provider during pregnancy about induction, even if you're not planning to get one, just so that you can get a good gauge of like, is this a good fit for me? Am I going to be satisfied when I get to my birth with still having all the options that I'm expecting? Or am I going to suddenly find out that I'm actually really restricted in the things that I can do during my birth, which then could potentially lead to a less positive birth experience? So one of the things that you may not know that you can do with Pitocin, that usually my clients will be like, what do you mean I could do that? Is you can ask for it to be turned down or turned off.
Yeah.
Whether or not somebody will actually do it is another story. But if your contractions are like on top of each other, you just feel really overwhelmed by them, especially if they're like back to back to back to back, you can ask for it to be turned off. Because sometimes your contraction monitor is not picking up all the contractions that you're having. And if your nurse or your provider is not watching you labor a little bit, they may or may not notice that you're having contractions very frequently. Hopefully they come in and they kind of watch you for like a few minutes to see. Not always, though. Sometimes they're busy. But if they're only watching the contraction monitor, they may not know that you're having tons of contractions. And so this is where communicating to be like, hey, like we're timing these and they're like less than 30 seconds apart. Like it's like back to back to back. That last one was like 5 minutes long. Like, can I get a break? Can we turn it down? Can we turn it off for a little bit? And usually if your oxytocin levels are high enough, you'll just continue to have contractions at a normal spacing. But more importantly, they're going to suddenly be much more tolerable for you. They're going to space out what is a normal distance from one another, and you can just kind of like catch your breath for a second. I've also seen that if you are being induced and nothing is happening, you are just, Pitocin is like maxed out and you are just chilling like Roxanne and I are, you have the option to turn it off and take a break as well. Like if nothing is happening, you are just hanging out, you can ask for it to be turned off so that you can eat something, you can shower, you can maybe take a nap or like go to sleep for the night and then try to restart in the morning, maybe with like another intervention, like another induction option as well. Because what's worse is to continue to get Pitocin and now you're super hungry and you're super fatigued and nothing is happening. Yeah. And then when we're on Pitocin too long, it could increase the risk of hemorrhage as well. Because again, those the oxytocin receptors get flooded as well. So sometimes you can do a break for like an hour or so to help kind of get some of that out of your system and reset. Sometimes you can ask for a longer break so that you can eat and shower and sleep and kind of like restart the process if nothing is happening. So your water is still intact, but the Pitocin is not doing anything for you. Take a break. Just chill. That is not always an option, though. That may not always be supported by your birth team, and so it's important to kind of communicate your preferences for it as well. I will say, though, most people do respond to Pitocin. I feel like it's less common for someone to be like,
definitely,
nothing is happening. But it does happen.
It definitely does happen. And in those cases, usually they either need more Pitocin, or what I've seen be really helpful in those cases is nipple stimulation along with the Pitocin. So we'll either like adjust the Pitocin knowing that they're going to do some nipple stimulation, but Pitocin, it's synthetic, it's man-made. Not everybody responds as well to Pitocin as they would their natural oxytocin. So I have had a client she was on like the highest amount of Pitocin times 2. Nothing. Chilling. So we turned it down and she did nipple stim and she had like 7 contractions in a row. Little much. I was like, you're doing too much nipple stimulation. They took a break. 5 minutes later, though, her labor kickstarted and she had her baby within. She does have a history of precipitous deliveries, but she had her baby within like 30 minutes after that situation. We didn't have to break her water. Her water broke on its own, and all we did was Pitocin. And she did a little nipple stim and had her baby.
And so you can do nipple stimulation with your hands, where you're kind of like twist and pulling on the nipples.
You twist
and kind of pull a little. I find an easier option is using the breast
Your
pump.
fingers get tired, okay? You don't got a lot of muscles in there. You get fatigued really easily.
Especially during pregnancy when your hands are more stiff. So
carpal tunnel.
Using a breast pump can be a really great option as well. And so if you're trying to like get your natural flowing oxytocin, and you can do it with Pitocin, you can do it in lieu of Pitocin to see if this kickstarts things for you. Usually what I would recommend is like 10 to 15 minutes on one side and then just kind of alternating for like maybe up to 2 hours. The only reason why I would personally limit it to 2 hours is because your nipples are going to get sore. And there's nothing worse than trying to breastfeed a newborn with sore ass nipples. So
to start.
It's like, so I would say about 2 hours. But we don't want to just do nipple stimulation. And we don't want to just do Pitocin or any sort of intervention. Like, we also want to set the mood.
And
set the labor vibe, because this is what's going to help with that oxytocin release. So we're not in a bright ass room with your partner talking super loud
watching Law and Order.
Like, we want to set the mood. So turn the lights off or dim them really like low, because usually I would say almost every labor room that I've been in, you can like dim the lights. You can set the mood. Play some soft music or music that you enjoy listening to. Maybe not like the metal, like let the body set the fire.
I think that's
I saw that reel. Don't do that song.
I mean, maybe, but
do like
it's
spa
not
music.
setting the mood.
Spa music,
yoga.
Like talk in a quiet voice, like both you and your partner. Like talk to baby. Like we're trying to set the vibe, which is like dark, dim, almost like you were trying to go to sleep. Like
Earth cave.
Set that vibe and do the nipple stimulation at the same time. Because like I'll have clients that are like, I did the nipple stimulation. And I was like, who was talking to you? It was like, my mom. And the lights were super bright. And I was watching my favorite TV show. And I was like,
which is The Bachelor. Very stressful show.
Like, girl, no. So if we're going to do nipple stimulation, or even if you are doing Pitocin and it's maybe not kickstarting it for you, set the vibe, set the mood in the room. And just that will really help with the oxytocin release.
Because we release oxytocin when we feel safe, supported at nighttime. At nighttime, a lot of people go into labor. I didn't include this at the beginning. Melatonin is a enhancer of oxytocin sensitivity, so that when it is at bedtime, we release more melatonin and it makes us more susceptible to the oxytocin. So at nighttime or in a dark area, we release more melatonin, and this increases our sensitivity to the oxytocin. So the birth cave, not only do you feel safe and supported in this birth environment, but you're also releasing that melatonin to make you more sensitive so that your oxytocin is like extra and sensitive on your
Extra
uterus.
strong. Extra strength.
strong, extra strength oxytocin.
Something else that you can do if you're feeling fearful is to do a fear release. This can also be really beneficial to helping with that oxytocin release and your sensitivity to it as well. So if you're feeling kind of afraid of something,
Like Pitocin.
or just something that's going on with your labor. So sometimes I'll have clients that have had like a prior birth experience they do not want to repeat that again. And so they're kind of afraid that same scenario is going to happen. And so we'll kind of talk about it, and they'll have their good cry, and then their labor kick starts.
Nothing like a
because
good
they
cry.
finally let it go, and they finally have found a place that feels safe for them in their body. Or I'll have people that have like their friends or their mom had like really traumatic births, and they're like, I do not want that. But they're afraid that they are too. Like, again, same thing. We address it, good cry, and they let it go. Or if they're concerned about something with baby, like if you are having medical induction because there's a complication for you or for your baby, like that could be something that we're feeling very afraid of. So fear releases, essentially, we are addressing whatever it is that we're feeling afraid of. We're addressing the elephant in the room. I find saying it out loud and then sobbing with it is really beneficial to like kind of just, it's like a big emotional release. And then we can finally feel safe in our body to allow labor to begin.
But doing these things during labor can be helpful to prevent needing Pitocin at all, or it can be helpful if you are being induced to set the mood for an induction, also releasing any fears that you're having around that induction. If you've been just told repeatedly throughout your entire pregnancy that Pitocin is evil and you never want it, it's going to make your labor so painful and whatever, all of these things, you're going to have a C-section because you got Pitocin. This is going to create a lot of fear surrounding your induction, especially if it's medically necessary. Like this is a medically necessary induction that's recommended for you and baby. This can make it very fearful and almost like you feel like you've failed in a way that you have to get Pitocin. But this can cause issues for your induction being able to start and progress because of that fear.
So let's talk about managing this fear of Pitocin, because even for me during my first pregnancy, I was very afraid of Pitocin because, again, all I ever heard was how horrible it is. It's evil. It's going to ruin your birth experience. And now there's even stuff out there on social media that's, it ruins your postpartum too. Like there's just, Pitocin does all of these horrible, horrible things. And so it's reasonable for someone to be afraid of it.
Yeah,
so let's talk
totally
about
valid.
Managing this fear that we have. And I don't want to dismiss anybody's fears that they have about it because I had them myself. And whether or not they were founded in reality, it doesn't matter. Like if you have a fear, it's a valid thing that you're feeling afraid of. And so let's talk about it. So I would say the first thing that would have been beneficial for me with Pitocin was when my provider told me that I was going to be induced and then had no other conversation with me. And I was like, why am I being induced? Because I was too pregnant. I was suddenly really afraid, but I didn't even know what questions to ask at this point.
Yeah.
Like brain, like what are the benefits and risks? Like I don't even know where to start with that at that point because I was just bombarded with being told there's something wrong and you need to be induced. And so I think what would have been really helpful for me in that moment is instead of trying to figure out what question should I ask, but rather tell my provider how I was feeling. And what I was feeling in that moment was really scared and really anxious about whatever this was. And so I could have expressed in that moment, which I did not, hey, I'm really nervous about induction. I'm really nervous about having to get Pitocin. Like I have this like vision of what I was planning for with my birth. And I feel like that just got crushed right now. And I need some reassurance of like why this is your recommendation. What other options do I have? Like I need you to reassure me right now and help explain to me why this is okay. And so things that would have helped me in that moment for my provider to explain to me, or when I made it to labor and delivery in spontaneous labor, and they were like, you need Pitocin. And I was like, what do you mean? And the midwife crossed her arms, and I was like, I do not want to talk to you. Would have for someone to be like, hey, when we administer Pitocin, we don't max it out right away. It's going to start really low, and then we slowly increase it over this time interval. Every 15 minutes, we increase the Pitocin 2. Every 30 minutes, we increase it too. But we can take a longer time increasing it, or they can present some options with how fast are they going to up the Pitocin for me. Like that would have been a little bit reassuring because I had this belief that it was 0 to 1,000 right away. And for some people, it can be.
Yes.
Like they don't need that much to really kickstart things. And so it can feel like, just over that hump. It can feel like it went from like not being so bad to suddenly being bad. And so I don't want to say that that's not true. But for most folks, if you are not in labor, your contractions will slowly build over time as the Pitocin levels increase. So it's usually not a 0 to 1,000, but I don't want to dismiss the folks that happens to either. Some of us are just more sensitive to oxytocin. So if someone had explained to me, hey, it's not going to be immediate torture, like it's going to be a slow build. We're only going to increase it until this point, until your contractions are at this spacing. Once they've reached that spacing, we're not going to increase it anymore. And we might even turn it down. Like we might even have an option to turn it off. And so if someone had explained that to me in that moment, other than being like, what do you want? I would have probably felt so much better about receiving Pitocin.
Like in that situation, obviously, because I was there, so I can ask questions. If they would have explained why the hell they were inducing you, that would have been really helpful.
That would have been super helpful.
Because I was a nurse and I just assumed you were in labor. So I showed up and I was like, oh, Gina's in labor.
I was in labor,
Had
though.
I known that you were there to be induced, I would have been like, you should not be induced. You are not ready to be admitted. You have more time until you are in active labor. Sorry, Gina, you are still in early labor. We need to go home. And I would have been like, hey, let's just go home because they're just going to give you Pitocin. Let's go home, take a bath. But nobody explained anything until they walked in with this Pitocin bag. And then I just assumed, oh, they must have already talked to Gina about Pitocin when she was in triage. And that's why we were waiting here this entire time. But I'm not going to be like, hey, Gina, tell me what happened in triage,
as
please.
I'm mentally spiraling.
As she's just like, what the fuck is happening? And I'm just like, what happened in triage? Tell me all the details immediately. What happened in there? Because I'm so confused. No, I'm going to be like, okay, I'm going to support Gina. Apparently she is okay with Pitocin. And then the midwife came in and she was like, I have no questions. And I'm like, okay, she has no questions. So we could.
Read the room, Roxanne.
Carry on.
Read the room.
I was also very tired. I wasn't on my A game at 3 a.m.
And so I also asked the nurse to turn it down, and she laughed at me.
But I also laughed at you when you were like, when do they turn this off? And I was like, they do not. And I was like, but why? So in that moment for me, what would have been really beneficial and probably have reduced my anxiety levels pretty significantly to prevent me from just spiraling emotionally was one, for someone to explain to me what the fuck Pitocin was and how they were going to be using it, why I was being induced, why they were recommending it. Like, just, give me the background information would have been super helpful. Explain how they were going to give it to me and then give me options with it. Hey, when we give you the Pitocin, this is what we're going to increase it to or until. And then we always have the option turn it off or turn it down. Like, a conversation would have been wonderful for me. And then also knowing that it wasn't going to be 0 to 1,000 right away, because that's what I was thinking it was going to be. And I was wanting an unmedicated birth. So I was like, okay, well, I've just heard how painful and awful these are. Give me something now, because I'm not going to be able to handle it. Because that's what I was always told. No one can handle Pitocin contractions. Like, they're so painful. They're so awful. When if I had been in a different mindset and had a different understanding of it, I may have not asked for IV pain meds right away. I may have been significantly more relaxed when it came to receiving it. Or I would have said, no, thank you. I'm going to go home. Yeah.
Which would have been probably the best option for me at that time. But I didn't fully understand what it was and what my options were. And I've only been told all of these horror stories about it from well-meaning people who were trying to tell me that the only way to give birth was to do it with nothing. No medication, nothing, no interventions at all. And that wasn't helpful for me. And so having conversation on why this is a recommendation, how are they going to administer it for me, what options do I have, when do they stop giving it to me, Like those would have all been really helpful for me to not just completely spiral. And I think would be really helpful for other folks that are feeling really anxious about Pitocin, because I'll even see similar things with my doula clients where they're getting induced for whatever reason, medical reasons, their own choices. And then as soon as the nurse is like, hey, we're going to start Pitocin, they're like, I need you here now. And I'm like, do you feel any contractions? I'm like, I'll come now if you want me there, but are you in labor? And they're like, no, but they're going to give me Pitocin. And I'm like, okay, let's take a breath together, because it's probably going to be a little bit of time. And then I'm like, it's not immediate. If it is immediate, I'll rush to you. But if it's likely not going to be immediate discomfort, it's going to be like a slow build. And then like 6 hours later, they're like, oh yeah, I'm glad you didn't come, because it would have been really awkward to sit here and stare at you for this period of time. And I'm like, I know, I'm here for you though. Whenever you want me, I'll be there. But same thing, like they've been told this story for so long about how horrible this medication is for a good reason. Like it can make your contractions more painful.
Yeah.
It can help you feel like you're not in control.
It's still a
anymore.
medication.
But it still has its tool. It's a tool that's available to you that you can use if you need it. And we don't have to be afraid of different tools that are available to us, because there's a reason for modern medicine. Not everyone needs every intervention that's available to them, but they're available to us if we do need them. And so knowing what those situations are by having conversations with our provider and helping them understand, like, I don't understand this and I need you to help me feel less anxious about it, can be a really good place to start, as opposed to being like, can you tell me the risks and benefits of Pitocin?
Yeah.
And
just
what are my
expressing like,
alternatives?
this makes me nervous, or I'm anxious about having to get Pitocin. Can you please explain Pitocin a little bit more to me? This could also be a really great learning moment for your providers and your nurses as well, because we don't get that question often. So being able and learning how to explain Pitocin in a way that it doesn't make people more anxious, but also in a way that they understand, and it makes it less of a fearful thing. And knowing that it's a tool, and we've had people tell us that like they had to get Pitocin, but it made them, knowing that it was just a tool in the toolbox rather than this scary thing that could cause all of these things to happen to their birth, was way more helpful for them to have a more empowered experience, because they were the one to be able to be like, yes, I know what Pitocin is, and I want to use that tool because that is what my birth needs. And I was the one to make that choice, not someone coming in and being like, okay, we're going to start Pitocin now. You have no idea what it is. Hold on for dear life. It's going to be a wild ride.
And so when it comes to Pitocin, it is a tool that is available for you during your birth or your induction, should you need it. And it's similar to every other intervention that is available to you. It's a tool that may or may not be necessary for you. If you do need it, it can enhance your birth experience by helping to increase your contractions, to bring them closer together so that you can meet your baby. There's a number of reasons that Pitocin may be recommended to you, but if for whatever reason you feel unsure about it or it's making you feel really anxious, asking the questions. And if you don't know what questions to ask, expressing how you're feeling is a really great starting point, and something that is usually pretty attainable to all of us, unless you don't like to talk about your feelings. Then maybe a little bit harder, but that's usually a good place to start if you're like, I don't know what I don't know and I don't know what questions to ask. Just start with how you feel. Hey, I'm feeling really anxious right now about having to receive Pitocin because I've heard all of these horror stories about it. I have this vision for my birth and I'm afraid that that is disappearing for me. I feel like I'm losing control right now. Those are things to express to your medical team, to your birth team, so that they can address those fears and those concerns for you. And they can help you understand why this is a recommendation, help you to understand what your options are. Because something that really contributes towards a positive birth experience is feeling like you were the one that made the decisions during your birth. And this doesn't mean that we make decisions in a vacuum without any consideration to any factors. We can make our decisions based on recommendations from our providers, from members of our birth team, from our partner, and then kind of gather all the information and then make a choice from there. But it's important that we are the one that felt like got to make that decision without feeling coerced or pushed into it. So if you are feeling anxious about Pitocin, know it's a tool. It's usually not 0 to 1,000 right away. I would say 99% of the time it's not 0 to 1,000. Some of us are just more sensitive to it, so I apologize for those of you that are listening. if you do receive Pitocin, and it is very
0
sudden,
to 100
your
real
doula
quick.
will be running to you at that time. They do slowly increase it over time, so it is a slow build, similar to your normal occurring oxytocin contractions would be. You can still stimulate your own oxytocin release so that you don't have to increase it too much by doing things like nipple stimulation, setting your birth vibe to really allow the space to feel safe, for you to feel supported so that your labor can continue with Pitocin or with a minimal amount of it, or potentially even turning it off. You do have options with Pitocin. You can turn it down, you can turn it off, you can take breaks from it if needed. So it's not just get Pitocin, increase it to the max as fast as possible until you meet your baby. There are options with it. And again, if you are unsure or you're feeling anxious, ask the questions, express how you're feeling. And that's usually like a really great way to feel more empowered in your birth. You can absolutely still have an unmedicated birth with Pitocin. And if you are being induced, if that is your goal, you can absolutely get an epidural and continue with your induction in your labor. It is totally your choice, but whatever your birth vision was, it's not ruined by getting induced if that's something that you and your baby need. So thank you so much for listening to this podcast episode. If you enjoyed this episode, be sure to like and subscribe to our channel. We'll release new podcast episodes every Wednesday and new birth stories on Friday. And we have a number of birth stories that are induction birth stories where folks had Pitocin, where they had both epidural births and unmedicated births. So if this is something that is making you feel more anxious, listen to those stories to hear each of their personal experiences with induction. If you want more support throughout your pregnancy, check out our online prenatal fitness programs and online childbirth education course. Our courses are designed to help you feel confident to move your body throughout your pregnancy with lifting modifications, with different exercises to help with pelvic stability, core exercises, also birth preparation and pelvic opening exercises. Our childbirth education course is designed to help you understand what is even going on when it comes to birth and to know your options, because that is a really good way to feel confident moving through your birth and to also feel empowered to make decisions, is to know what those decisions even can be. You can check out both of those courses on our website, but if you're postpartum, you can check out our postpartum prep course, which I guess is more of a pregnancy course as well, but we have newborn care in there, infant massage, infant and toddler CPR, in addition to our postpartum return to fitness program. So if you want to figure out how do I go from having a baby to getting back to the gym and the sports that I love, we have programs designed to support you throughout that return to fitness phase.
If you're a professional and looking to learn more from us while earning continuing education credits, we have a birth workers and a prenatal postpartum fitness trainer course that you can check out. Again, all on our website at mamastayfit.com. And you can use code STORY10 to get 10% off any of our offerings as a thank you for listening to this entire episode. This podcast is sponsored by Needed, which is a nutrition company focused on the perinatal time frame. Needed is something that both Gina and I have taken during our pregnancies, postpartums, preconceptions. Our husbands take them. We really love their products, and they're very intentional with all of the things that they do with that product. And you can use code MAMASTAYPOD to get 20% off your first order with Needed.